plus million Americans a year suffer from thyroid disease. It's no joke. And it's very frustrating when you know that there's something wrong and your doctor will not listen or doesn't know what to do. So just to break down that there are two different types of thyroid disease. The first is called hypothyroidism, and that is a underactive or low thyroid, meaning that it doesn't produce enough of the thyroid hormone that it needs to function properly. And there's also a milder subclinical form of hypothyroidism, and 4.3 to 8.5% of Americans suffer that. That is a large number, y'all. Hashimoto's disease is an autoimmune condition which actually attacks your thyroid, and that is the number one cause of a hypothyroidism. And I myself actually do have Hashimoto's disease, which was diagnosed after my third child was born. And it's typically treated with levothyroxine, which is also called Thyroid. All kinds of different names for them that are generic, but Thyroid is the main medicine that is used. When I mentioned the milder subclinical form that 4.3 to 8.5% of Americans suffer from, that is actually what that means is that the thyroxine levels are normal, but the TSH is high. So there are a lot of different components that you need to look up in the blood work. So you don't necessarily have a disease when you have that milder subclinical, but it's still definitely a disease. Some of the things that you suffer from are low cold tolerance, exhaustion, constipation, depression, and weight gain. Yuck, none of us like to have that. The other side of the coin is called hyperthyroidism, and 1.2% of the US population suffers from that type. And that is categorized by excessive production of the thyroid hormone. And one of the leading causes, up to 50 to 80% of the cases who have hyperthyroidism, is caused by Graves' disease. It's treated with beta blockers, methimazolone, which one form is Armour, and Nature Thyroid are some of the different brands. And when you're hyper, you suffer muscle weakness, irritability, sleeping difficulties, a fast heartbeat, weight loss, and heat intolerance. So that is the two types of thyroidism, thyroid disease rather, in a nutshell. As I mentioned, I myself have been a sufferer of Hashimoto's for some time now. I've had thyroid issues for some time. I guess I would be kind of classified as the milder subclinical that eventually turned into a Hashimoto's. So what I want to tell you, and I have so many friends who may or may not be watching right now, and you know who you are, but let me tell you that it's enough to drive you crazy, because you know intrinsically that there's something not right. You're tired all the time, and it's not just like tired, it's like dead tired. It's like pregnancy tired, yet you're not pregnant. So I want you to know that you're not crazy. Okay, I'm also gonna say I am not a doctor. I am not making any diagnoses here. I am just giving you the information that I have found helpful in my journey with hypothyroidism. But I do want to say that there are two different schools of thought in diagnosing this process, these diseases. And you're not crazy, because oftentimes you go to a LabCorp or a Quest, and you know, next to your blood test results, there is a range that says that you're supposed to fit into that box range. So if your TSH is 5, that still fits in the range. No way, guys. 5 is not normal, and I'll get to what normal is in a second, but oftentimes doctors, even endocrinologists who should be ashamed of themselves, will look at these standards and say, oh, you're within range, when first of all, not everybody's body is different, and somebody who works well over 2 when they have hypothyroidism like me might be okay. I feel awful when my thyroid is over 2, and I have to be controlled. The second thing is you really need to find yourself a doctor who listens to you and trusts you, because not only do you have to treat the blood work, but you need to treat the symptoms and the person. And I think that that's super hard to find. Endocrinologists, you know, I'm sure you can find them all over the place, but finding one who actually thinks outside the box with you is super hard to find. So I wish you guys lots of luck in finding that. 60% of people who are suffering symptoms on either side of the spectrum are unaware that their cause is due to their thyroid, which is super interesting, because clearly that means that people are just not being diagnosed with it. It's crazy. And 1 in 8 women at one point in their lives will suffer from a thyroid disorder. So very, very interesting. So let's get to the numbers in a second. And again, I am no doctor. These are the numbers that I kind of live by. Doesn't mean that that's good for you, but I will tell you that, again, those numbers that are going to be listed on your LabCorp or your Quest document, to me, that never worked for me. So what is considered normal? So TSH is considered normal in my group, in my friend Allie's group, probably Melissa's group, all y'all. A TSH from 0.1 to 1.5, if it's within that range, if you're hyper or hypo, usually a good range to be in. And again, gonna differ from what you see on LabCorp standard. TPO antibodies, which is your thyroid antibodies, I've read in some places that anything over 0 is abnormal and means that your thyroid is being attacked, but it can also, anything over 20 is considered positive in terms of having a thyroid attacking disease. Your free T3 needs to be between 3.5 to 4.3, and your total T3 140 to 175, and your free T4 0.8 to 1.8. Now, guys, you guys can all Google, you know, whatever you want. And again, I am no doctor. I'm not telling you what's normal, what's not normal, but I will tell you this is, you know, the ranges that work for me. What can you do to control your thyroid? So the first thing that comes to my mind, because I'm going to be seeing Kelly Clarkson in 4 short weeks, is I'm sure everybody has seen her face plastered everywhere saying I went on the thyroid diet. So I was kind of curious to see what that is, and she automatically just lost all this weight, supposedly not exercising and all that stuff. So obviously we know diet. Diet can absolutely help us when it comes to our thyroids. I'm saying in addition to medication, I am one who believes that you need to be on medication. I'm sure that there are lots of people who choose to address these problems other ways. I myself feel better on medication, but you do, and whatever is best for you. Also, avoiding certain foods like gluten. Gluten, don't even get me started on gluten. I'll have to do a live on gluten one time, but gluten is so horrific for you. But certainly if you have an immune condition, which Hashimoto's is, getting rid of gluten can be the best thing for you. Making sure that you're getting your thyroid retested often is super important. I think most endocrinologists have you come back every 6 months. Depends on how stable you've been. It might be within a year, but you really need to have that thyroid tested constantly, because those numbers can absolutely fluctuate. And if you're pregnant, those numbers, and you suspect that you have an issue, need to be checked monthly. When I was pregnant, monthly, and there were always adjustments made, because thyroid is something that is super important when you're trying to get pregnant, while you're getting pregnant, and can have really disastrous results if it's not stayed within check when you're pregnant. Stress is a killer of your thyroid too. Stress is a killer of everything. Stress is the worst thing for your body, and gosh only knows we all have it. But reducing your stress by doing something that you enjoy, or help meditating, doing exercising, any way that you can to reduce that stress, I think is very helpful. There are also some known foods that are helpful to facilitate within your body as well, and those are coconut oil, apple cider vinegar, fish oil, ginger, and vitamin B. Doctors, depending on who you're seeing, sometimes will try to make you feel like you're crazy and that you're within range. And my if anything that I can impress upon you today is that with any doctor, not just an endocrinologist, that you stick your grounds. And if something's not right, if you're not feeling right, you need to keep pushing and pushing and pushing until you get the results that you need, such as what my case was, is that I kept seeing my thyroid go from 2 to 4 to 5 to 7. And at that point, my doctor was like, that's within normal range, my regular doctor years ago, and refused to put me on thyroid medication. Well, just, you know, FYI, I got put on thyroid medication and then came Maggie. So just saying. So push it. Always advocate for yourself. I'm a big advocate when it comes to medicine.